Hi, my name is Michael McGonigal. I'm a trauma surgeon at Regions Hospital. I'm also the chair of the Minnesota Metropolitan Regional Trauma Advisory Council. The members of the RTAC have approved the implementation of a protocol for pre-hospital providers requesting a trauma team activation for patients being transported to all hospitals in the metro area. This protocol is called TTA Timeout. The purpose is to improve communication between pre-hospital providers delivering the patient and the trauma teams receiving them. Although this protocol was developed in East Central Minnesota, it's available and recommended for use by any pre-hospital agency or trauma hospital. The TTA Timeout protocol helps to provide a safe and effective handoff from pre-hospital personnel to the receiving trauma team. The procedure is as follows. First, the medic arrives with the trauma patient and announces TTA Timeout in the trauma bay, at which time everyone is quiet and gives their attention to the EMS provider giving the report. Next, the patient remains on the transport stretcher during the timeout, except in cases where CPR is in progress upon arrival to the ED or any other condition that requires immediate life-saving intervention. All urgent care, such as ventilation, will continue. Next, the primary EMS provider gives a verbal report to the leader of the trauma team in the commonly used MIST order. M stands for mechanism, I stands for injuries identified, S is symptoms, which includes all vital signs, GCS, and pupil exam. T is treatments provided. Then finally, the EMS providers will ask if there are any questions. The patient can then be transferred to the ED stretcher. Pre-hospital providers then exit and the trauma team takes over. We recommend that posters outlining the timeout process be mounted on the wall in the trauma resuscitation room to serve as a reminder to both pre-hospital and hospital staff to implement the TTA timeout. Copies of this poster are available on the website. The remainder of this video depicts a simulated trauma team activation TTA timeout for your review. Thank you in advance for your adherence to this new protocol. We're hopeful that this process will improve communications between pre-hospital and hospital staff, as well as improve patient care and outcomes.
All right, everybody, this will be a TTA timeout. Mechanism, we have a 26-year-old male involved in a motor vehicle crash. He was entrapped. Extrication took about 11 minutes. Driver of the second vehicle was deceased. Injuries include a right femur deformity and midline bruising. He has abrasions to the left forehead and face, as well as to the bilateral forearms from the airbag. Signs and symptoms, ABCs were intact, but patient was unresponsive. Initial vitals were blood pressure of 88/56. Pulse of 96, O2 sats of room air were 84%. Initial GCS was 8, with shallow and clear respirations at 8. Pupils were equal and reactive to light. Treatments included patient being RSI'd without complication, 16 gauge IV to the right AC, as well as a IO to the left tibia. Hair traction was placed on the right leg with good CMS. He's received 900 mLs of normal saline en route and administered 10 milligrams of IV morphine. Any questions?
No thanks. Nice job.
All right.
All right, let's get him over here.